Welcome to, what is today? Friday, I guess. It is Ask Dr. Geier Live. I should know that it's Friday because I only do this show on Fridays, but my week's been all off with the holiday on Monday. I hope wherever you're watching, hope you're making today your masterpiece. Yes, it is Ask Dr. Geier Live, Friday, 12 p.m. Eastern Time. The one place, the one time that I answer your questions, whether that's health and wellness, whether that's orthopedic, surgery, rehab, recovery. This is the time to ask those questions so that I will answer them. Now, please remember, I cannot give you medical advice on this show. I can't, I'm not your doctor, so I can't give you specific medical advice. What I can do is offer information and education that helps you then ask your doctor, what about this treatment? Or, this idea, this surgery, whatever it is. I can help translate whatever that doctor said, maybe, however I can help you, I'd like to try. I am, like I said, Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. And as always, just know that I will stay as long as there's questions. If it's a lot of questions, and some days it is, we'll be here 20 or 30 minutes. Some days it's not many at all, and I'm here 5, 6, 10 minutes, something like that. So, Cynthia, I may be saying that wrong, says, hi, why inner knee injury won't heal? Almost 2 years, don't want it surgery, no MCL grade 3, why it's very slow. I'm not 100% sure what that means. No MCL grade 3, there wasn't a grade 3 MCL injury, or there was and it hasn't healed. I'm not really sure. One thing about MCL injuries, so the MCL is a ligament on the inside, the medial side of the knee. So if this is the front, this is a right knee. So the inside, outside, this is the MCL, big, thick ligament on the inside of the knee. If most of the time that does heal on its own. Grade 1s, grade 2s, especially mid-substance or off the femur, typically heals on its own. The one that sometimes doesn't is a grade 3 injury, especially off the tibia, because what can happen is it pulls off the tibia and then it flips outside the hamstring tendons that attach there. Then there's no way for it to heal itself to bone, and yes, you do typically need surgery to reattach that, put it in the right place, hold it in with anchors, screws, washers, that type of thing to get it to heal in place. I don't know if that's what happened in her case, but that can be problematic. The other thing is you want to make sure there's not anything else going on. That's not the only thing on the inside of the knee. There's the meniscus, the C-shaped shock absorber on either side of the knee. See how well I can show that here. There's also the cartilage lining on the ends of the bone, the articular cartilage. You could have breakdown of the cartilage on the medial side of the knee. There's probably other things as well, but those would be kind of the common ones. All right, Sherry, what is osteochondral autograft of the talus? So let me see. I don't know if I'm going to be able to show this on my ankle model, but let me try. So the talus, let me get that off the screen here. The talus is the bone of the ankle below the shin bone. So this bone right here, the sort of the weight-bearing part of the talus. And when you get what's called an osteochondral defect, usually from a really bad ankle sprain, you will end up with sort of a divot. If you can picture a divot on a golf course, like when the ball lands on the green and it creates a indentation where when it says osteochondral, chondral is the cartilage, osteo is the bone under it. So you literally have a sort of a crater of bone and cartilage, and you have to fill that, because if you don't, eventually that will develop arthritis. You no longer have the support there with continued weight bearing. Usually it's either there or there. With continued weight bearing, it will eventually break down and get further arthritis in the ankle joint. So typically when you fill that in, you have to take a cylinder of bone and cartilage from somewhere else. Autograft means it comes from you, usually the knee, or you get what's called an allograft, where you get a donor cylinder of bone and cartilage from somebody that dies, and they harvest his or her organs, and they harvest a cylinder, or usually it's the inside of the knee, but they probably take the talus as well, and then you could do an allograft surgery. That surgery actually does very well. It's outpatient surgery usually, but it's a very long recovery because you have to protect it, usually non-weight bearing, anywhere from 6, sometimes up to 12 weeks. Slowly work to get range of motion back. Then you start weight bearing. Then you start strength. Then you start more sport specific activities and just physical demands, and that process just takes a long time, but it can go very well if that's what's going on. Tony Berry, broken tibia and fibula 15 years ago, issues with muscle bone 5 inches up for the ankle, can be very bad, level 9 pain. Yeah, I'm not necessarily why you would have pain 13 years out from the injury. I would want to know if it healed, make sure that there's not something going on in the bone. 5 inches up from the ankle's a little high for a syndesmosis injury. The ligaments between let me put this, tibia and fibula, what they call a high ankle sprain, 5 inches would be up here. That would not typically be what it is. So I'd want to know more, whether that's just repeating x-rays or getting an MRI to figure out if there's a structural reason for the pain. It may not be bone, it could be muscle, chronic exertional compartment syndrome or any number of things, but those would be things that I would want to know. My knee does not bend the last 6 years. What do I do? That can be a really tough problem because I don't know in your case, again, not medical advice, but the longer a knee stays stiff, the less likely that something like physical therapy will get it. It's certainly a reasonable place to start, but typically you're going to be talking about surgery to go in and clean out scar tissue and try to improve range of motion, and then do a lot of work with physical therapy and maybe a continuous passive motion machine after surgery to keep whatever motion you get at surgery. It's less than ideal. With range of motion of the knee, you always want to prevent losing it rather than treating it once you've lost it. But having said that, surgery is usually what is entailed. Mary, it is good to see you, a frequent contributor. Looks like that's it. So I will just say as we wrap up, if you'd like to come see me as a patient, again, I have 3 board certifications: orthopedic surgery, orthopedic sports medicine, and anti-aging and regenerative medicine. And I can offer you all kinds of treatments, not just surgery, cortisone, and physical therapy. If that potentially interests you, and if you're potentially willing to come to Charleston, South Carolina, click the link in the description below, fill out that form, and I'll get back to you. My assistant and I will get back to you and tell you a little bit more about how we could potentially work together. I hope you have a wonderful weekend. I look forward to seeing you very, very soon on our next Ask Dr. Geier Live. Have a wonderful